And we're live.
Good afternoon. Thank you for your gracious invitation to join you today. After years of working with children with chronic conditions, in 2008, I began working with adolescent and young adult survivors of childhood brain tumors. I've learned so much from those families that I hope to share with you today. I hope that I can communicate what they have taught me. Based on this experience, I'm going to explain the scope of my talk. I was asked to talk about self-care, and I've expanded that to talk about both self-care and family care. While I understand that that's different than what I was asked to talk about, I feel that this expansion is really important because of what we have found from the families whom we have studied and the advice that they've given us. As a first step in that process, I'd like for you to think about doing a 360-degree assessment about your current experience. Think about where you are today and ask each member of your family, what have you been through and where are you going now? And what are you experiencing today? How has this experience impacted you, your survivor, and the family? Can you consider alternative approaches to your current situation? Taking all of this into consideration, what do self-care and family care look like for you? When I was asked to do this talk, I Googled self-care, and this was the kind of definition that appeared. Something about doing things we need to do to maintain our happiness, our health, and the ongoing development of our minds, our bodies, and other aspects of ourselves as human beings. We can do this in whatever way works for us, and I'm sure that we can all agree with this. We are usually also reminded that self-care isn't selfish. We all are told from the very beginning that we need to put on our own oxygen masks before we can save other people. We're also reminded that there are many strategies to use to practice self-care. Which ones of these may work for you? And then there's also self-care during a global pandemic. How has the pandemic further impacted your self-care and the ways, your typical ways of providing self-care for yourself? Have those been disrupted? Do you have new ways? Or maybe not. Maybe they've called everything to a halt. Sounds like we all need a self-care check-in and check-up, and that's what I'd like to do today. I'd like to start by listening to Grace's reflections about what she's been through as a mother and a caregiver for a young adult childhood brain tumor survivor. How might these issues impact her self-care? How might similar issues impact your self-care?
There are many hard parts, but there's so much more easy part. The easy part is then, just loving her. The easy part is knowing that we have support and that it's okay that she's not the child we had anticipated her to be when she was younger. So the hard part is seeing full of life, outgoing child who had no fear, not being able to fulfill her dreams. Sometimes that's hard for me. So some of the hard parts that are even harder for me to talk about is the expectation that I won't meet her needs. Another hard thing is what will happen if I'm no longer around or dad is no longer around. Mm-hmm. So those are some hard things for us to think about.
So Grace says many profound things in that video, but all in all, she's talking about those things that make us work harder and harder to meet our child's needs, to fix things, to make things better for our child. So we ask caregivers, what are your typical challenges around family care and self-care? And we did quite a bit of study on these in the home, in the hospital, and all around. And we found that survivor independence, survivor well-being, and survivor late effects were those issues related to the survivor. There was issues also related to the caregiver, combining the parental role with that of the caregiver role. And then advocacy and support, providing support to the young adult while advocating for their well-being and the well-being of the family and the well-being in themselves. And then there were family-oriented challenges around engaging in activities considered usual for families, keeping those going in your family. And also a big one for long-term survivors are sibling issues, sibling well-being, making the siblings all part of the same family. So these are things that we came by after listening to individuals such as Grace. So we worked on these and pondered these for quite a long time. And we found that all families seem to have similar challenges. That is, the families that were doing really well had the same family challenges as the families that said they weren't doing too well. And then we did more studying, and we found out that there were certain families that we would call condition focused that seemed at higher risk. And these families, in terms of their challenges, there were some red flags. Now, these families were working so hard, so it's sometimes hard to spot, but they're depicted on the slide. Caregivers view themselves as responsible for all aspects of family management. So the caregiver was directing everything in the family. But sometimes we're at a loss for what to do and repeatedly tried the same solution and expected a different response. It's like me when I'm fixing my computer, right? I do the same thing over and over, but the same thing happens. It doesn't work. And also having this sense that they needed to fix the problem and make the survivor happy. And that the well-being of the family was really on their back and depended on them. Well-being of the survivor was on their back. And most poignantly, despite all of their work, the survivor was literally in the middle of the family and were isolated and feeling like they had lost their roles of being a son, a daughter, a sibling, a nephew, a niece, and a maturing young adult. Instead, literally kind of removed from them and in the center of the family and still a patient or still marked by their condition. Remember that the healthcare system and nurses like me tend to reinforce these kinds of goals and behaviors. So if you're feeling some of these apply, no worries. They apply to many families. Remember, we're just learning how to support family and self-care. We did find some families that were what we call family focused. Mothers who were family focused reported successful problem solving that balanced the needs of family members with the survivor. The survivors are perceived as essentially the same person as they were prior to having the brain tumor in ways that were important to the family. These families were able to manage, accommodate, and accept their differences. In terms of family management challenges, they were successful not because they didn't have challenges, but they problem solved them differently. And that their outcomes were better. I'll explain that in a moment. As shown on the slide, the survivor was integrated into the family and functioned as a son, a daughter, a sibling, a niece, and a maturing young adult, and not so much of a patient. And here's another way of talking about this. Condition focus versus family focus. So we really found the differences being this sense of being able to problem solve and consider the whole enchilada instead of focusing on the condition so much. And miraculously enough, to our surprise, we thought, well, we should all focus on the condition certainly, but the family focused families had better outcomes. So the survivor, the family, and the caregiver all were doing better. And meanwhile, I neglected to say in the beginning of this that fathers and other caregivers are included in our work. This, we're focusing on mothers because most of our work has been done with mothers. For this age, for older survivors, 99% of the caregivers are mothers. But we've recently completed a project with fathers, but all of this applies. And many times we talk about who is the primary caregiver. And that part of our work means bringing in the secondary caregiver, or that person who's not so much on the front lines, into more of the action. But I'm getting ahead of myself for a different day. So let me talk a little bit about my work. And I'm using this as an exemplar, not to, whatever, to brag, but I just want to communicate the baby steps that we're trying to take to try to build a supportive intervention for families. So our goal is to improve the quality of life, not only for the survivor and the family and the caregiver, but we also are taking, as I said, a family systems approach. We modified an existing intervention called Bright Ideas for Everyday Living in consultation with caregivers, families, and survivors. And here's our homepage. We have 7 sessions built around those challenges that we talked about. TIPS is a web-based program that we have both synchronous and asynchronous features. So the synchronous features are these sessions that the caregiver has with a coach, and the coach follows them throughout the 10 weeks. Each session has a pre-session, a session, and a post-session. The pre-session is just completed by the caregiver, and the post-session and the check-in session or the post-session is completed with a coach. The TIPS mother works through 5 of these sessions. She selects them, what's most meaningful for them. And in the sessions, videos of other mothers such as Grace are used to help explain the challenge and alternative ways of problem solving such challenges to promote a less condition-focused approach. In the sessions, we also have booster sessions or check-in sessions, the alternate weeks, in which the mother begins to understand the successes that he or she is having with the problem-solving approach. And in the final check-in session, we give them really a list of where they've gone, where they've been, where they're going, what their successes are, what their goals were. that the mothers just love to be able to see their whole trajectory throughout the experience. We also have other asynchronous features on the website, such as resources, all the different things that they might be looking for in terms of this period of the survivor's life. We have full-length videos of mothers who are in this stage of caregiving as well, and some information about the team. This is just a shot of a session. We do a Blue Jeans session within the TIPS website. Let's listen to Tracy about what she learned about her condition-focused strategies and how she moved to more family-focused strategies through this process, how it's changed her, the survivor, and the family, and improved her own self-care.
It has helped my family more than you would know.
Can you tell me a little bit more about that?
Well, I was always thought I had to protect Ronnie and do things for him and make sure he had everything in a row, basically controlling everything, every aspect of his life because he needed help.
Mm-hmm.
But I have learned through this program that I'm hindering him and not helping him. And he needs to be his own person and learn on his own way in his own time. And I had it the reverse of what it should be. And this taught me that I needed to not necessarily let go, but let him make his own choice and live his own life.
And be a mother in a different way.
Yes, and I never saw it that way. I always saw it that I just was in protective mode, and it was like a helicopter mom. No, you can't do this. No, you can't do that. It'll hurt you. It'll hurt you. When meanwhile, he's not becoming the person he wants to be. He's becoming what I want him to be, or not becoming what I want him to be, just me thinking that I have to just protect him.
Well, you know, it makes sense that that's kind of how we're taught to be mothers, right? You know, we're supposed to protect and take care of things, and you know.
I think you overly do that after an experience like this, and you don't know how to stop, and you just keep doing it. But you think you're helping them, but you're really not.
So tell me how you think the program helps you kind of reorient your energies. Because I know you're still using the same amount of energy, but in a different way.
It's totally different way. It helped me because Shannon and I would take a problem that I didn't really see it being a big problem until we took it into pieces. Are you there?
Yeah. Mm-hmm.
We took it and we analyzed every little piece of the puzzle until we figured out what the problem was, piece by piece by piece. And the common denominator in each piece was me, that I was doing too much. And I saw that probably within the 5th week, a light bulb went off in my head, and I was like, oh, it's me. It has nothing to do, I mean, it has everything to do with him, but it's the way I'm interpreting what I'm supposed to do with him and how I'm not letting him be himself. Does that make sense?
Yeah, that makes a lot of sense. So you said taking apart the problem helped. What else helped in the process?
She made me live my life as well. Like I would not go anywhere or do anything because I was always waiting for him to come home on time or, do the, okay, well, no, I can't leave him. And it taught me that I have a life to live as well. And I need to live my life, care for him, but in a different way. be here.
So it helped you look at the impact not only on his
His
life,
life
but your
but my
life, and also the rest of the family.
at 100%, because I think a shift of one little shift changed everything
Right.
for the good.
Yeah.
But I
Yes,
never saw that.
And it seems like even I read the final summaries, of the conversations, and it sounded like even that was so for your ex-husband.
Yes, he's actually here right now, and we get
Yeah.
along very well. But prior, we did not,
Mhm.
because we didn't see eye to eye, or he actually wanted me to be the way I am now, but I wouldn't do it because I thought I needed to do this for Ron,
Mhm.
but
Mhm.
I don't.
Right. Yeah,
So,
he wanted more for you too, it sounds like.
yes,
Yeah.
he did.
Yeah.
So the whole, and Ronnie has been more involved in my everyday family. Like, my family is very tight, it's very big. There's a lot of us, we're always together. And it just brought him in closer back to us. Like, I lost him for a while, and I think it's because he felt like I was being helicopter mom, and I wasn't allowing him to be himself. And I think when he saw me start backing away, he was shining.
And then, in fact, he kind of took your direction more
I
in some
had
ways.
no idea that this would happen, or I understand how it happened, but I never thought this could be this way.
Right.
My mind didn't think that way.
Well, it's like, it's this, I'm from the Midwest, is excuse an expression, it's kind of backwards, because you think, well,
Very
the more
backwards.
because the more I do this, the more it should be better.
Helping.
Yeah.
Yeah.
Instead
And
of,
it-
if I step back, and then he'll see, oh, Mom may have a point there.
Yes. And I never, like, I have put myself in therapy. I put him in therapy. And I'm not saying anything that the therapists weren't great therapists, but they didn't understand where we were at. Because I don't think you truly understand unless you live it or know somebody who's lived it or deal with it on a daily basis.
Right.
I got more out of this program than I did with any therapist I went to, because I went to a couple. And what Ronnie went through, and what Ronnie, different therapies I put him in, this program helped the most.
And in a sense, you might know now what more to ask from a therapist. You know what I mean?
Yes, that
I
is
want to
true
work
too.
I want to work on X,
Right.
and
Right.
you could almost kind of, like, for me, almost like identify it.
Well, and
This is my
before I couldn't. Like
I'm a mess, fix me,
Right. They couldn't help me because they couldn't pinpoint where to start.
Yeah.
But Shannon did, and she made me see things that I never ever did before. Amazing. It really was. So kudos to you guys, because thank you for that. It changed all of our lives for the good. Really did. It,
So again, I think that, like Grace, Tracey said some very profound things. And it's not just so much about tips, but it's what I really wanted you to get from that is about her experience and about how we kind of get set in motion when our child has a catastrophic condition that may be life-threatening, and how we can right ourselves after that and move on with our lives. So I think this has a lot to do with families and self-care. So some takeaways that perhaps we can all take from this are, what challenge is your priority at this point in time? Think about what is really the thing that you would want to focus on. and build toward considering more caregiver and family-oriented issues and action plans, and brainstorming pros and cons and deciding on that action plan. And try to maintain a family focused. Who in the family is involved with the solution? Does it make it more family focused? Maybe not, but start with you and think about that ripple effect for the rest of the family. It really works. And what does your family think about this plan? You often need to start with an open-ended question and a conversation that's been avoided for many years. If I had any takeaway from my experience with families, that last sentence would be it. The best move toward family and self-care. Most important, self-care may best be balanced with family care. That balance occurs through problem solving by yourself and your family. So we're working on tips right now, and we're working on ways to disseminate it to families across the United States, working toward those steps. This is the team that I work with. On the right-hand side is Dr. Barricat. She's head of psychosocial oncology at CHOP. Wendy Hobby's in the left-hand upper corner, nurse practitioner in the survivorship program. Some of you might know her. And the other three individuals, Heather Zukin, Shannon Bresler, and Taylor Flatt, are our three coaches for TIPS. They're volunteers, they're psychologists and nurses, psychiatric nurses, who work with us to implement TIPS. There's many other people on this team that made this possible, from designing TIPS to testing it, and many different funders along the way, from our National Institutes of Health. Presently, the Oncology Nursing Foundation is funding our efforts through a generous grant. And this is my information. If you would ever be interested in our work, in joining us in some ways, interested more about our study or more about our work ongoing, please feel free to contact me. I am retired, but as my husband would say, I'm still working at what I love. So thank you so much for this opportunity, and I look forward to your questions.